Welcome to Learn Medical Spanish. Today we're going to do a cardiovascular review of systems in Spanish. So quick reminder, I recently created 5 really focused beginner lessons about medical Spanish, some of the first stuff you'd want to learn about. And you can get that by going to learnmedicalspanish.org/lessons. So it's really high yield, especially for providers, meaning doctors and PAs and NPs. So if that's you, I definitely think it's worth checking out. So go to that link, or I'll put a link in your podcast app and on YouTube as well. So it should be easy to find. All right, so let's go ahead and get into it, the cardiovascular review of systems. So we're going to start with this introductory phrase, which is, do you also have or have you had? So think about how to say that in Spanish. It's kind of like 2 different questions, but we're just putting them together. Do you also have or have you had? ¿También tiene o ha tenido? ¿También tiene o ha tenido? And so that you use that phrase in front of any of these other ones to kind of introduce all the rest, or at least most of the rest. The next part is pain or pressure in the chest. Dolor o presión en el pecho. Dolor o presión en el pecho. Palpitations. Palpitaciones. Palpitaciones. A very fast or slow heartbeat. Un latido del corazón muy rápido o despacio. Un latido del corazón muy rápido o despacio. So I won't break down that whole phrase, but just the word latido is the one that's for the beat, like the heartbeat, latido del corazón. Next, swelling in your legs. Hinchazón en las piernas. Hinchazón en las piernas. One or both, meaning one leg or both legs. Una o las dos. Una o las dos. So why did we say una instead of uno? Because it's describing the word pierna, which is feminine. So una pierna. Lightheadedness. Sensación de que se va a desmayar. Sensación de que se va a desmayar. So admittedly, that's kind of unnecessarily long, but this is getting into the specificity of like what kind of dizziness somebody is having. So you could just say mareos, which means dizziness, but just like in English, the word dizzy is really ambiguous, so you don't necessarily know what it means. So if you want to specifically ask like if they're going to feel like they're going to pass out, then that's what this question is for. Do you feel like you're going to pass out? Or did you, or whatever. Sensación de que se va a desmayar, because desmayarse is the reflexive verb that means to pass out. All right, next phrase is heart attack, as in have you had a heart attack? Ataque al corazón. Ataque al corazón. When? ¿Cuándo? ¿Cuándo? Clogged heart arteries. Arterias tapadas en el corazón. Arterias tapadas en el corazón. And I know some of these phrases are kind of complicated, but if you can even just remember one key word from the phrase, then that might be useful in the future. Like tapada means blocked, or tapado if it was something masculine that was blocked. So arterias tapadas would be blocked arteries or clogged arteries. All right, next phrase is heart valve problems. Problemas con las válvulas del corazón. Problemas con las válvulas del corazón. CHF, and this is not going to be an acronym like English. It's a couple of words instead. CHF. Insuficiencia cardíaca. Insuficiencia cardíaca. And you can probably tell what that means, which is cardiac insufficiency. All right, next is atrial fibrillation. Fibrilación atrial. Fibrilación atrial. And I'm guessing that's one of those phrases that, depending on where the person has lived for the last many years, maybe they would understand an English version even better, like AFib, like sometimes with MRI or stroke, people might understand it better in English if they're used to hearing it in English or whatever. But it just depends on where they've been living and how much Spanglish they've been learning in the medical setting. All right, next. Other heart problems. Otros problemas del corazón. Otros problemas del corazón. Have you passed out? And remember, we talked about this word earlier specifically that means to pass out. Have you passed out? Se ha desmayado. Se ha desmayado. Today, meaning have you passed out today? Hoy. Hoy. So why is that se ha desmayado and not just ha desmayado? Because it's a reflexive verb. And so those reflexive verbs always have that extra pronoun. I'll leave it at that for now. But they always have an extra pronoun. It just kind of means it's something that happens to oneself. Is kind of what that's all about. All right. Okay, so remember I've got those focused beginner lessons, super high yield for providers. You can find those at learnmedicalspanish.org/lessons. And if you're on YouTube, there's a playlist there with a bunch of other dialogues. If you're on the podcast, obviously you can just scroll down and see what all the other different topics are that I've covered. And there's a video there on YouTube about my CME course that you can check out as well. Thanks for watching or listening. I'll see you next time on Learn Medical Spanish.